Poor blood circulation. Signs you should never ignore, and what causes it. Blood circulation is fundamental to life. Every cell in your body depends on a steady supply of oxygen and nutrients delivered through your blood. When your circulatory system is functioning well, your organs perform optimally, your skin looks radiant, and your brain operates with clarity. But when circulation becomes sluggish, the effects ripple throughout the body. Poor blood circulation is more common than many people realize, and the signs can be subtle at first, but if left unaddressed, it can lead to severe and potentially life-threatening conditions. Understanding the signs and causes of poor circulation is essential for early intervention and long-term health. One of the earliest and most noticeable signs of poor circulation is cold extremities, especially your hands and feet. If you frequently experience icy fingers or toes, even when the environment is warm, this could be a red flag. Your body prioritizes vital organs, and in cases of compromised circulation, blood flow to peripheral areas like the limbs is reduced. This is the body's way of preserving core temperature and essential functions, but it leaves your hands and feet cold and often numb. Another sign closely related to this is a tingling or pins and needles sensation, which indicates that nerves in these areas are not receiving adequate oxygen or nutrients. This sensation, known medically as paresthesia, is often ignored or mistaken for simple fatigue or nerve pressure from sitting or sleeping in a certain position. But if it happens frequently or without a clear reason, it warrants further investigation. Another common symptom of poor circulation is swelling in the lower extremities, particularly the feet, ankles, and legs. This condition, known as peripheral edema, occurs when blood is inefficiently returning to the heart and begins to pool in the extremities. The pressure from this stagnant blood causes fluid to leak from blood vessels into surrounding tissues, leading to visible puffs. Swelling can become more noticeable as the day progresses or after long periods of standing or sitting. In severe cases, it can even make wearing shoes uncomfortable or walking painful. Alongside swelling, you might notice that wounds or cuts on your legs and feet heal more slowly than usual. This is a critical sign that blood carrying oxygen and immune cells is not reaching the site of injury efficiently, which hampers the body's ability to repair itself. Slow healing is especially concerning for people with diabetes, where circulation problems are often compounded by nerve damage. Discoloration of the skin, especially on the toes and fingers, can also indicate poor blood flow. A bluish, purplish, or pale hue in these areas may reflect oxygen-deprived blood or blood that is not circulating well. This condition is called cyanosis and can sometimes be mistaken for bruising or a temporary reaction to cold weather. However, chronic discoloration may signal deeper vascular problems such as peripheral artery disease, a narrowing of the arteries that supply blood to the limbs. In women and older adults, poor circulation may also cause hair loss on the legs or a noticeable reduction in leg hair growth. This seemingly superficial symptom is actually an important clue. Hair follicles, like other cells, require nutrients and oxygen to thrive, and poor blood supply can cause them to become dormant or die. Fatigue is another silent but powerful indicator of compromised circulation. When your muscles and organs don't receive enough oxygenated blood, they can't perform efficiently. This results in a constant feeling of tiredness, even after a full night's sleep. If you find that your energy levels are consistently low, your workouts feel harder than usual, or you struggle with simple physical tasks, it could be due to reduced oxygen delivery caused by impaired circulation. In the brain, poor blood flow can cause dizziness, difficulty concentrating, memory issues, and even mood changes. Your brain needs a steady supply of oxygen to function at its best, and when circulation is inadequate, it suffers. This is why some people with circulation issues describe feeling like they are in a mental fog or find it hard to stay focused. Men and women may experience other specific symptoms related to poor circulation. For men, erectile dysfunction is a frequent but under-discussed sign. An erection requires increased blood flow to the pelvic region, and when circulation is impaired, this process is disrupted. For women, poor circulation can contribute to menstrual irregularities, reduced fertility, and complications during pregnancy, as adequate blood flow is essential for hormonal balance and reproductive health. Additionally, varicose veins, twisted, enlarged veins near the surface of the skin are another telltale sign of poor circulation. They occur when the valves in the veins weaken or fail, allowing blood to pool instead of flowing back to the heart. This not only causes cosmetic concerns, but can also lead to pain, heaviness, and fatigue in the legs. Now that we've covered the major signs, let's explore the causes of poor circulation. One of the leading causes is atherosclerosis, which is the buildup of fatty deposits known as plaque inside the arteries. These plaques narrow the arterial passages, making it harder for blood to flow freely. Atherosclerosis can affect arteries anywhere in the body, but is particularly dangerous when it impacts the coronary arteries, cerebral arteries, or peripheral arteries. High cholesterol, smoking, poor diet, and sedentary lifestyle all contribute to this condition. Another major cause is diabetes, a disease that damages blood vessels and nerves over time. High blood sugar levels cause inflammation and structural changes in the arteries, making them less flexible and more prone to block. People with diabetes are also more susceptible to infections and slower wound healing due to poor circulation. Blood clots are another culprit. These are clumps of blood that have changed from liquid to gel-like or semi-solid form. While clotting is essential to stop bleeding, unwanted clots in the veins or arteries can obstruct blood flow. Deep vein thrombosis, a condition in which clots form in the deep veins of the legs, is a particularly dangerous example. These clots can break loose and travel to the lungs, causing a life-threatening pulmonary embolism. Sitting for long periods, such as during air travel or desk jobs, increases your risk of DVT and poor circulation in general. Obesity also plays a major role in circulatory health. Excess body fat places added pressure on your arteries and can interfere with blood flow. It often goes hand in hand with other circulation-damaging conditions such as hypertension, diabetes, and high cholesterol. Lack of physical activity compounds the problem, as movement is critical to promoting healthy blood flow, especially in the lower extremities. Smoking is another major factor that compromises circulation. The chemicals in cigarettes damage blood vessel walls, promote inflammation, and accelerate the formation of plaques. Nicotine itself constricts blood vessels, making it harder for blood to reach your extremities. Over time, this leads to chronic circulation issues and increases your risk of heart disease, stroke, and PAD. Chronic stress can also contribute. When you're stressed, your body releases hormones like cortisol and adrenaline that constrict blood vessels and raise blood pressure. If this stress becomes chronic, it can lead to long-term vascular damage and reduced circulation. Additionally, autoimmune conditions such as lupus, rheumatoid arthritis, or vasculitis can damage blood vessels and impair circulation. These diseases cause the immune system to attack healthy tissues, including the lining of blood vessels, leading to inflammation and reduced blood flow. Temperature sensitivities, especially cold intolerance, can also be rooted in circulatory problems. Conditions like Raynaud ecstasies cause blood vessels in the fingers and toes to spasm in response to cold or stress, dramatically limiting blood flow to those areas. The result is white, then blue, then red discoloration accompanied by numbness or pain. While Raynaud's is often benign, it can be a sign of underlying vascular issues. Poor posture, especially prolonged crossing of the legs or slouching, can restrict blood flow to certain areas of the body. Over time, this can lead to nerve compression, numbness, and discomfort, especially in the lower limbs. Hormonal imbalances also play a role. Estrogen and progesterone influence vascular health, and fluctuations, such as those during menopause or from birth control, can affect circulation. Thyroid dysfunction, particularly hypothyroidism, can also slow metabolic processes and reduce blood flow efficiency. Even dehydration can impact circulation, as blood volume drops when you're not adequately hydrated, making it more difficult for your heart to pump blood effectively. Likewise, anemia, condition characterized by low red blood cell count, or hemoglobin, means there is less oxygen carrying capacity in your blood, leading to fatigue, dizziness, and cold hands and feet. When it comes to prevention and treatment of poor circulation, lifestyle changes can make a dramatic difference. Regular physical activity is one of the most powerful tools to boost circulation. Aerobic exercises like walking, cycling, and swimming improve heart function and help keep blood vessels flexible. Strength training also supports good circulation by building muscle and promoting healthy blood flow, especially in the legs. Eating a diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats helps reduce inflammation and plaque buildup. Specific foods that support circulation include beets, garlic, turmeric, berries, fatty fish, and dark chocolate. Staying hydrated and avoiding excessive alcohol or caffeine are also important. Quitting smoking is non-negotiable if you want to preserve vascular health. It's never too late to stop. The body begins healing almost immediately. Stress management techniques like meditation, yoga, deep breathing, and adequate sleep can also improve circulation by reducing hormonal imbalances and blood vessel constriction. For those at higher risk or already experiencing symptoms, medical treatment may include blood thinners, cholesterol-lowering drugs, blood pressure, medication, or procedures to open blocked arteries. Compression garments may be prescribed to support venous return, especially for those with varicose veins or edema. If you're a diabetic, managing blood sugar is essential. Regular checkups with your doctor, especially if you have a family history of cardiovascular problems, are crucial to catch issues early and prevent complications. In conclusion, poor blood circulation is a condition that often begins subtly, but can have widespread consequences if ignored. From cold hands to chronic fatigue to serious complications like stroke and heart attack, The signs of impaired blood flow should not be underestimated. Understanding these warning signals and addressing the underlying causes, whether like metabolic or vascular, is the key to preserving long-term health. The good news is that with the right knowledge and proactive care, you can significantly improve your circulation and enhance your quality of life. Do you want to wait for serious symptoms to develop? Start paying attention to what your body is trying to tell you and take steps today toward a healthier, better circulating future. Thank you for taking the time to learn about the vital signs and causes of poor blood circulation. Your health is your greatest asset, and staying informed is the first step toward protecting it. If you found this video helpful, please consider giving it a like and sharing it with others who might benefit from this information. Don't forget to subscribe to our channel and hit the notification bell so you never miss out on our latest health insights, tips, and in-depth guides. Your support helps us continue to create content that empowers and educates. Until next time, take care of yourself and stay healthy.